Finally, tonight, New Jersey is breaking new ground in women's health. Before leaving office, Governor Murphy signed the Menopause Coverage Act, requiring insurers to cover medically necessary care for both perimenopause and menopause. Supporters say the new law recognizes this stage of women's lives as a real public health issue, not a private burden. Senior correspondent Joanna Gagis reports as part of our Under the Dome series.
Menopause is a real issue that impacts women, sometimes significantly, physically, mentally, emotionally, economically.
And yet, for so many women, treatment for menopause and perimenopause symptoms has been unavailable or unaffordable. But that's about to change in New Jersey with the passage of two bills that were championed by Assemblywoman Heather Simmons and signed into law just before Governor Murphy left office.
I can speak to my own experience where in the past I've been prescribed a service or treatment that my policy didn't cover, but I could talk to a girlfriend or a relative with their policy, and their policy may have covered it.
The first bill mandates health insurance companies cover a range of treatments that includes private health insurance plans, state plans for government workers and school employees, and New Jersey Family Care, the state's Medicaid program. However, it excludes Medicare. Those treatments include
HRT, hormone replacement therapy, as well as bioidentical hormone treatments. We're also looking at non-hormonal treatments and medications that support menopausal symptoms. We've also included in here behavioral and mental health services, pelvic floor physical therapy, bone health, and other screenings, as well as preventative services that are rated A and B by the U.S. Preventive Services Task Force. So in other words, things that insurance already covers, but when the determination is that the cause is menopause, it still has to be covered.
A second bill offers continuing medical education credits focused on menopause and women's health. According to Simmons' office, many clinicians today receive little to no formal training on menopause or women's health during medical or nursing school. That, combined with a faulty study from NIH in the early 2000s recommending against hormone replacement therapy, has led to many doctors not prescribing it over the last 20 years. Dr. Shefali Patel is an OBGYN in private practice who says HRT has tremendous benefits across all aspects of a woman's health.
In terms of cardioprotection, in terms of metabolic protection, reducing the rates of diabetes, neuro and cognitive decline. And then we've always known about osteoporosis, like women who have been on HRT, their bones are healthier, their bones are stronger. And then there are the things that we don't always look at in studies, things like sexual satisfaction, the impact of, having vaginal atrophy, the impact on libido, the impact on your mood, impact on sleep. We have receptors for estrogen and progesterone in our eyes, in our ears. So patients have dry eye. Some patients are complaining of itchy ears, ringing in the ears.
In November, the FDA removed the black box warning that's been on HRT since 2003, but Patel says many physicians are still not up to speed and will question her for prescribing hormone treatment.
Not only was I educating my patient, I was sometimes educating the doctors that they're being seen for other things for. And I think that we really have to do this 20 years of damage to women's health by really educating all the doctors that are involved in women's health, and especially the primary care doctors, the cardiologists, the neurologists. Like, those are the doctors that often have overlap in most women's care.
Those two bills can really ensure that women don't have to, on the one hand, do so much research themselves. So this will ensure that the doctors are more informed and hopefully keeping up on the latest developments in all the menopause symptom treatment.
Allison Kalshed is the co-founder of Not Your Mother's Menopause, an organization that educates women and connects them to resources around post-maternal health.
Now those things will be mandated to be covered under this Menopause Insurance Act, right? So there's not going to be a barrier to getting the care that you need so that then they can continue on in the workplace. I mean, the amount of money that is lost in the workplace due to women calling out sick or not being able to perform as well as they normally can because they feel brain fog or they're having a hot flash in the middle of a meeting. These are real dollars and cents issues that hit the economy as well as our lifestyle.
Insurance coverage will start in April, and the continuing education takes effect in June. Simmons says she's working to update medical and nursing school curriculum next. For NJ Spotlight News, I'm Joanna Gagos.
Under the Dome is made possible in part by the Corporation for Public Broadcasting, a private corporation funded by the American people.